Hi, welcome to presentation for hypertension or high blood pressure in functional medicine. My name is Teesia Brown. I am a nurse practitioner, and normally what I do is I work in nephrology, which is kidney care, and I love functional medicine, but my passion is educating people. So just to let you know, the information that I'll be presenting today is for informational and educational purposes only. It's important that you seek out a healthcare provider before adopting any extreme lifestyle changes or medication, including herbs or supplements. So let's talk about what are blood pressure parameters. It's important that you know your blood pressure parameters. So when you go to the doctor's office, you know what's normal for you. You know if you have white coat syndrome, which is something people get when they show up to the doctor, their blood pressure is up. Some of the new parameters right now, or some of the new guidelines they're suggesting is that they don't usually start a patient on blood pressure medication until they have 3 consecutive elevated high blood pressures. And then they're also recommending that patients keep a tab of their blood pressures at home so you can see if there's a difference between the home and the office blood pressures. But just so you can kind of get a good picture, all the learned organizations, all the guidelines, JNC 8, American Heart Association, and the European Society of Cardiology have these guidelines. If you are greater than 60, they want to start you on medications if your blood pressure is 150/90. If you're less than 60, adults, and your blood pressure is 140/90, they want to start you on medications. American Heart Association says if you are at 130/90, they want to start you on blood pressure medication. Normal parameters for the American Heart Association is 120/80, and the European blood pressure parameters are 140/90. So what we can agree is anything higher than 140/90, most likely you need to start medications. But we don't want to focus on medications. We want to focus on alternative care, alternative lifestyle options. So just a fun fact so you can kind of get the picture of how stress, poor diet, lack of exercise all play a role in your blood pressure. So fun fact is when your blood pressure is elevated, when you are under a stressful state, your pupils have a change, your mouth becomes dry, you have hearing problems, of course you have heart problems, you have stomach problems, bladder, you don't pee, you don't poo, your mouth becomes dry and you sweat. The body is going to take everything and move it to a different location. And when you are under chronic stress or a chronic type of state, then it's going to cause further problems, further breakdown in our bodies. So let's go to some of the causes of high blood pressure. So poor causes of high blood pressure, and I'm just going to go through the list and then I'll kind of go back and focus on a few items. Lack of activity, sedentary lifestyle, a poor diet, overweight, BMI greater than 25. So that is they take your height and your weight and that's how you get the BMI. And if it's greater than 25, then you are considered overweight. Your age, genetics, medication, if you smoke cigarettes, alcohol, stress as mentioned, and then elevated cholesterol, which is kind of a part of the whole cardiovascular disease process anyway. So when you talk about sedentary lifestyles, I think it's important that you understand that just because you may work at Amazon and you walk a lot, or just because you may work in a hospital and you walk a lot, that is something that your body is used to. So it's nothing that's outside the box. So that is not considered necessarily exercise. Sometimes you may need to incorporate weights, or maybe you lift weights all the day, all the time. You work at Amazon lifting packages, so you're actually lifting weights, but you don't have any exercises that cause you to kind of breathe a little harder, like anything like a running or walking a little briskly or anything like that. Poor diets. Eating out, period, is the most horriblest thing in the world, because eating out, um, fast food restaurants, they are not in the business of your health. They're in the business of making sure the food tastes good for you so you to come back. So they're not concerned about how much sodium, saturated fat, unsaturated fat, vegetables. They're not concerned about any of that. So eating out is a poor diet. Things out of the box, you have to consider things in the box have been preserved. So there are a lot of preservatives on it, a lot of sodium phosphates, a lot of this, that, and the other that increases salt intake. So even if you're not adding salt necessarily to your food at home, if you're eating things out of the box, there's the salt. One of the highest things is spaghetti sauce. You see low sodium, but sometimes they've added extra sugar. So it's kind of like a tricky situation. So it's very important that you read your labels, know what's in the ingredients, and find out what works for you. Um, Overweight, of course, you're carrying more body mass, so your body has to work harder. So in turn, sometimes you have an increased blood pressure. That does not apply to everybody, but it can apply. Age, as people get older, the reason that you saw the blood pressure parameters that were higher for people that were greater than 60 is because that top number sometimes increases over time. It's just part of aging. Medication, things like ibuprofen that we take all the time for pain can increase your blood pressure. Steroids that you get sometimes when you're sick and you have a cold or you've injured your back, those can also increase your blood pressure. Smoking messes with your blood vessels, in turn increase your blood pressure, and alcohol does the same thing. But no, those are carcinogenic type activities, so they actually cause oxidative stress. So when your body tries to heal and repair, it does not repair and heal the same way anymore. The other thing is stress. Stress is a huge thing. Stress can interfere with your sleep. It can increase your cortisol levels, cause you to gain weight. It can put you in a position where even though you feel like you're eating correctly, even though you're exercising, you notice that your blood pressure hasn't come down and you're still not losing weight. There is a link between gut brain activity. There's a link between the amount of stress that we endure and the different type of enzymes and the different type of proteins and things that increase in our body that can cause us to have high blood pressure because we're stressed. So when we kind of talk about the blood pressure, we talk about blood pressure, and you need to consider for those that have already been diagnosed. A lot of times you have difficulty coming out because your body has reset the thermostat. You've been running at a high level for so long that the body's desires to create homeostasis. So that's a balance. So there is a thing called a barrier reflex. It's like in your aorta. It's a stretch receptor. It's also in the neck area. What happens is when these receptors recognize that the blood pressure has changed, whether it's either too low or too high, it sends signals to the brain. The brain sends back out signals to either get the blood pressure up or the blood pressure down. But when you've been at that state for so long, it resets the thermometer. So now maybe when you jumped up to 170 over 98, the body went out of its way to try to lower. But when you stay at that state for a long period of time, then it's going to make that the new blood pressure. So you may not see the 130 over 90 or the 120 over 80 anymore. The other thing that I want you to consider is emotional stress when you get upset about a situation. Things like school for people that have chosen to go to school, when your children get upset, poor marriages, when you have a stressful work environment, when someone says something to you, those can actually affect your blood pressure. Um, and then also, I stress to you again, when you stay under a level of stress for a long period of time, the body will reset itself to that new heightened state, and it's not a good thing. Effects of hypertension on the body. So, when you walk around with blood pressure this high for this long, these are things that can happen to you if you don't do something about it. You can have strokes, you can have heart attacks, headaches, dementia, aneurysms throughout the body. You can have damage or narrow arteries, blindness, heart failure, kidney disease, decreased sexual function or the sexual health. A lot of times with men, if your that vital member is not working, you need to really focus on your cardiovascular health. It's usually the beginning stages. It's usually the tell all. It's the thing that throws up the red flag to warn you that there's something else going on with the blood vessels throughout your body. And then also, walking around with high blood pressure causes a chronic state of inflammation in your body, which also can cause um, poor healing, loss of energy, and then further cardiovascular damage. And then some of the labs that a lot of times physician runs to see if you're at a state that would be concerning in regards of your long-term inflammation is the CRP test, and you'll see that done, and it just talks about just what I said. Um, so how would we treat high blood pressure? So the recommendation is patients, people with high blood pressure need to exercise about 150 minutes a week. You need to get out there and you need to find out what's right for your body. So you may not be able to run a marathon, and you may not be able to go to a spin class, but what you can do is you may be able to go to a yoga class. You may start by walking to the mailbox and coming back. One of the things that I tell many people is I tell them that while they're in the kitchen and they're waiting for their food to cook, get you some cans out of the cabinet and do some push-ups with your arms. Get on the side of the sink, do some push-ups this way. Do some squeezing your shoulder blades. That's exercise. It's building muscles. Grab onto the side of the sink and do some squats. Get the chair, and while you're waiting, you can try some dips with your arms, or you can even do some toe taps while you're sitting. But there's always opportunity to exercise when you're sitting around waiting. Another important point is meditation. So you can meditate, you can prayer, you can deep breathe. But what you need to understand is deep breathing is super important. Just as an experiment, I just want you to try it. Start by checking your blood pressure after you've sat down for about 5 to 10 minutes and take some deep breaths and relax. And then wait a little bit longer and focus on nothing but deep breathing. And while your blood pressure is taking, I want you to say the words, I am relaxed and nothing matters. I am relaxed and nothing matters. I don't want you to think about anything. I don't want your mind to go anywhere. And while that blood pressure is taking and you're taking those slow, deep, purposeful throat breaths, I guarantee you your blood pressure will drop. It may not be 2 points, it may be 10 points, but it will drop. Breathing and biofeedback, many studies have been done to show that it works. Traditional medicine. So traditional medicine is necessary, but you need to understand that traditional medicine be temporary. So if your doctor prescribes you blood pressure medication, take that blood pressure medication if it's that high while you're making actual dietary changes, exercise changes. Dietary changes are really super important. Same way with stop smoking. But when you make these changes, know that this is not something that's going to happen overnight. Unfortunately, your state of being did not happen overnight. You did not get in the predicament that you are with high blood pressure or trending high blood pressure overnight. Something happened to cause this to be at this state. So smoking cessation is really super important because smoking messes with your blood vessels. And then alcohol reduction. As far as, even though there's studies that show that drinking 4 ounces of red wines, the bold ones, is good for cardiovascular health, I personally think that you should probably avoid alcohol if you have history of high blood pressure until you get things under control. Maybe you can add it back later, but for now, cut it out. So some of the other most important, like, direct treatments that you can try with high blood pressure is whole food plant-based diet. I am a super supporter of it. There's lots of books out there. There's lots of bloggers. There's Dr. Greger. There's so many doctors out there that is sharing information on how to switch over to a whole food plant-based diet. There's studies that show that people that follow a whole food plant-based diet actually decrease their blood pressure. And there's studies that show when you compare people, so let's say you got the carnivore that eats meat, then you got the pescatarian that's a fish person, and then you got the vegetarian that eats vegetables but they include cheese and egg in their diet, and then you have the vegans, and I say vegans next because vegans vary. They do different things. Some people are vegan plant-based. Some people are vegan Oreos and liquor or alcohol. That can kind of change how healthy you are. And then there's plant-based people that are truly following whole food, not olive oil, but olives. That's not to say you can't have olives, but not olive oil and olives. Instead of drinking orange juice, they're eating the whole orange. Instead of apple juice, they're eating the whole apple. So when you say whole food plant-based, that's exactly what that is. Most of your foods are going to come from nuts and grains and just pretty much whole items, and you're going to get it fresh as possible. Those are options. But again, when it comes to some of the other traditional things, is the Mediterranean diet is highly recommended to get your blood pressure down. The DASH diet, highly recommended to get your blood pressure down. Reducing sodium in your diet is important. On my previous talk, I talked to one of the participants asked about pink Himalayan salt. I think pink Himalayan salt is a good option. Some people have an issue with that because our salt is iodized, and yes, you do need a portion of iodine. But in my opinion, I use pink Himalayan salt. I've never had any issues in regards to that. But still, when you're using salt, it needs to be small amounts. You need to be cooking things at home. Does not need to come from a box. And you need to be adding other herbs and other spices to bring out flavors instead of adding nothing but salt. And then again, fiber is key. Fiber is very important in our life. It kind of helps us process things slower. It helps you have good bowel movements. It lowers cholesterol. There's a lot of things associated with making sure that you have a high fiber diet. Reducing animal fat is super important, especially red meats, all unnatural sugars, and then also saturated fats are not good. So saturated fats are usually found in poor fake products, and they're also found in meat. Some antioxidants that are high in nitric oxides that can help lower your blood pressure because nitric oxides actually open up your blood vessels are greens. Having greens daily, that's literally what you should do. You should find a way to have a green daily. One of the things that I do, because I kind of am busy, is I literally take spinach, small amounts, and I may put like some type of ginger shot on it, or I may put fresh ginger on it, a little lemon, and I put just a little bit. It works out anywhere to 2 to 4 ounces, and I drink that as a shot every day before I leave out. There's a lot of people that use the different little grasses, but you need to get greens in every day. And then other options are arugula, beets, basil, cilantro, rhubarb and green beets. Beet greens, which are good. Then some supplements, but again, you need to get with your physician and ask them what they think about this because herbs are powerful. They actually work and they many times can interfere with the medication that you're taking. So make sure you talk with your provider about it. But dandelion root, and I'm talking about the dandelions that are in your yards. I'm not telling you to go get dandelions out of your yards, but the dandelion with the beautiful yellow flower that we mow over or we spray things on it to kill it is good for hypertension. CQ10 is good for heart health. Magnesium is good for heart health. Apple cider vinegar will temporarily lower your blood pressure. Arginine and also taurine will also help with blood pressure issues. So I want to talk about functional medicine because some of you may need to seek that type of provider if you've tried everything and you feel like you're doing everything you're supposed to and you're still not getting results. So functional medicine is an individualized care. It focuses on holistic treatments. And yes, they do use traditional medicine. They focus on your mind. So what is causing the stress? Do you have any past traumas or anything? Your body, what's going on with your body? Why do you have high blood pressure? The deep dive, and then your spiritual beliefs, prayer, meditation, those things. No, they don't help you but they help you find you some way to reduce your stress. They do, as I mentioned, a root cause deep dive. So essentially, this is a detailed assessment. They do lab values. They'll go over histories like when did the diabetes show up? When did the high blood pressure show up? What event happened? So they can correlate events along with different sicknesses or different problems that have happened in your life. They do lab analysis that are same as your regular doctor, but they also do things that are a little bit outside of the box. Like they may do stool studies, they do genetic testing and things of that nature to kind of line up with maybe there's some food that you're eating that genetically does not work with your body because everybody is different and everybody is individual. Um, and then also, most people understand hormones are a big deal. Hormones will change your blood pressure in a large amount. It will change the whole composition of your body because your hormones are either too high or too low. So they consider those things too. They also, as I mentioned, integrate traditional medicine with naturopathic medicine. So they may choose to give you a vitamin and a supplement to go along with the other medication that you're taking. But always remember, medication is supposed to be temporary. You weren't born this way. Now, if you were born with, you have some type of chronic problem, then that's a little bit a different story. But for the people that have slowly transitioned into adults and older, and you notice that you're starting to have issues with weight gain and high blood pressure, if this wasn't something that you had when you were way younger, this has a lot to do with your lifestyle and your diet. So some of the things they do is lifestyle diets, and it's not a temporary diet. Yes, elimination diets are, but your changes should be permanent for life to help you consistently maintain a level of health. Incorporating exercise to your diets, herbs, and then different supplements that can help causes maybe some of your hormones to come up, or also maybe you're low in vitamin D. They associated that with weight. They're associating that with cardiovascular health. So, in conclusion, the one thing that I want to leave you with is if you don't make time for your health, you will make time for your sickness. So, my name is Teesia. I would like to thank Pure Life and Renee for hosting me today. I appreciate your time. Thank you for taking a few moments out to become educated and to give a little food for thought so you can follow up with your provider.